If you feel bloated every single day, that is not normal digestion. There is something that is driving it. My name's Dr. Andy Thanjan, and I'm a gastroenterologist, and today we'll go over what are the common causes of bloating and what can actually help. When we think about bloating, we actually need to figure out what is the exact symptom that we're talking about. One, it could be gas, which could get better with belching or passing gas from below. Another is distension, which is just your abdomen poking out some more. A third could be related to irritable bowel syndrome. Irritable bowel syndrome is the brain-gut axis or having a sensitive intestine. And that means that with even minimal air that's in your intestine, you may feel that symptom of feeling bloated or discomfort that someone without irritable bowel syndrome may not have. Abdominal bloating could also mean just feeling pressure in your abdomen or your belly area, even though it is not protruding out. What are the 5 most common causes of bloating? Number 1 is diet related. This could be related to carbonated beverages, artificial sweeteners, and something called high FODMAP foods. You can look up what FODMAP means, which are a bunch of long words that explain complex sugars, foods that have complex sugars, which end up getting fermented by the many bacteria in our intestine, which increase gas production and intestinal distension, which could feel like bloating. So when we think about that, high FODMAP foods could be a dietary cause, which is causing you to have chronic bloating. A second very common cause of bloating is constipation. And when I mean constipation, it could be that you are not having a complete bowel evacuation. So even if you're going and having a bowel movement every single day, if it's not a complete bowel evacuation, meaning a complete emptying of stool from your colon, you could feel bloated because of this. A third cause is irritable bowel syndrome, which is, as I mentioned before, having a sensitive gut or the brain-gut axis, which can increase your symptoms of bloating. Number 4 is food intolerances, such as lactose. People you may hear say that they're lactose intolerant, which means that they don't have the enzyme necessary to break things down that are dairy products. And when that happens, if they don't have enough of that enzyme, that causes increased fermentation by bacteria in the intestine. So small intestinal bacterial overgrowth is exactly what it sounds like. That's when there's too much bacteria migrating up the small intestine where it's not supposed to be, and that causes more fermentation and gassiness in a patient. That can be diagnosed, and if diagnosed, could be treated with antibiotics. But I only really look at this with my patients after we address the much more common causes of bloating. When is it something more serious and just not a nuisance symptom? Things that are red flag signs would be weight loss, anemia, which is a low blood count, persistent pain or severe pain, as well as persistent vomiting. What are ways to actually help if this is a benign cause of chronic bloating? One is to increase fiber gradually. Ideal amount of fiber that I recommend to my patients is 25 to 30 grams of fiber a day. And if you're on average eating 10 or 15 grams of fiber a day, you have to slowly increase over weeks to get to this higher amount. Being on this higher fiber diet may help in terms of not only the microbiome, like I mentioned, which is the many bacteria in the intestine, but it can also help with bowel regularity. Number 2 exercise regularly. Number 3, avoid carbonated beverages. The reason I tell patients this is that carbonation is added CO2 bubbles that are going into your stomach, which will make you more prone for bloating as well as belching. And number 4, consideration of elimination diet trials. So it's often helpful for a patient to keep a diary of certain foods that might be their triggers. If they're unable to figure what are their obvious triggers, they can try to avoid high FODMAP foods as described before. And if they're able to do that for 4 to 6 weeks with complete elimination of those high FODMAP foods, they could start to add food groups back in to see if they have potential food triggers, which is making them more prone to have abdominal bloating issues. If you want clear, practical explanations of GI health by a gastroenterologist, subscribe. I post new videos regularly.